So Rupa, once a lady finishes with her treatment, what are the things that you would recommend for them?
Thank you, Dan. There are about 2.5 million survivors of breast cancer, as we talked about, and they live with some of the toxicities of the treatments that we have offered them with the hope of making them live longer. Some of this are from the chemotherapy that they may receive adjuvantly, and some of these, it is always advisable to discuss with your physician the chemotherapy that you received, even if it was many years ago, especially as we know that there are some toxicities to the heart that may develop later on in life. And your physician will be aware of this and would check you for hypertension, check you for diabetes, as any of these other conditions may add to the contribution from the chemotherapy to your heart. Secondly, I would talk about the psychosocial impact of chemotherapy and any other treatments, including surgery and radiation to the woman. This is a life-changing event. It's physically also something that does change the consciousness level and the physical appearance of the woman and her relationship with her spouse. It is imperative that you discuss with your physician and your oncologist about your sexuality, about any problems you're having during the treatment. Some of these treatments can lead to problems with vaginal dryness, and there are a lot of products that do not have estrogen in them or progesterone in them that may help you with that. From the hormonal treatments that we use, we do expect to see some menopausal symptoms like hot flashes, taking a baby aspirin, vitamin E, some other dietary changes are ways of alleviating that. Again, it's very important that you discuss with your physician your individual indications or contraindications to any of these products. A lot of patients always ask me about what they can do in addition to what has already been done in terms of chemotherapy, surgery, radiation, possibly hormonal pills. And I always tell them they can do a lot. There have been recent studies that have looked at the role of exercise. And again, we're talking about regular exercise that you and me can do, walking about an hour for 3 days of the week. And that has been shown to contribute to a reduction in disease recurrence in breast cancer. And that was one of the pioneer studies that actually showed that regular exercise program can reduce your risk of any cancer. In terms of diet, the American Cancer Society recommends and follows the guidelines of recommending from the other government sources the 9 fruits and vegetables, eat 9 a day. That includes a combination of both fruits and vegetables. The more colored the fruits, like the colored, like purple eggplants, the reds and yellows, they contain numerous antioxidants, anti-cancer products, lycopenes, and these are ways, if you incorporate them in your diet, that's a very positive step towards your survival as well as your disease-free recurrence that you will be taking. At our center, we offer an integrative program that incorporates mind-body healing, a psychologist, a nutritionist, a lot of programs that are aimed at increasing physical activity, as well as cutting stress from one's life. These programs have been shown to complement our treatments of standard chemotherapy, hormonal agents, surgery, and radiation. I think the role of stress and the immune system has long been a subject of study by the NIH and other agencies, and it's something that in the future we will have markers to suggest that how stress can impact our survival from cancer.
Thank you.